This is 80-year-old Judith Smetkevich checking out of Millard Fillmore Suburban Hospital Tuesday.
The moral of this story is you have to be proactive with your health.
A few weeks ago, the scenario seemed unlikely. Late December, Smetkevich took an ambulance to the hospital with a severe case of COVID, and by January 2nd was on a ventilator. Attorney Ralph Larigo says the family was told she had a 20% chance of survival.
A son does all this research, and the family gets together, and the son convinces the ICU doctor to give her ivermectin.
On the experimental treatment, Larigo says the patient improves enough in 48 hours to move to a regular COVID floor. However, the doctors there will not give her the follow-up doses of ivermectin, and Smetkevich's condition deteriorates again. She's sent to the cardiac ward. The family, desperate, asks the attorney for help.
I tell him the only thing I can do is bring a lawsuit.
By January 8th, the family has obtained a court order from State Supreme Court Justice Henry Nowak, who ultimately says if the patient's doctor prescribes the treatment, the hospital must administer it. Back on ivermectin, Smetkevich starts to improve again, leaving Larigo to question why they had to get the court order in the first place.
When there are no alternatives, and when there's very little downside, and when it's demonstrated this type of effectiveness, people should know about it.
Ivermectin is a drug approved by the FDA to treat and prevent parasitic diseases. But UBMD Physicians Group Executive Director Dr. Kevin Gibbons says it's not clear yet how effective it is in treating COVID.
I don't know that we have a really true double-blind, placebo-controlled trial, the things that we really need to prove something works or doesn't work. This is a drug that has a better safety profile, for example, than hydroxychloroquine.
Larigo says people want to try the treatment, and he's received calls about this case from all over the country and even different parts of the world.
I've sent our paperwork to different lawyers, and we've got people that are asking for help. It's a shame they have to go to that. It's a shame they have to hire a lawyer to do what should be their right under these circumstances.
Ryan Whalen, Spectrum News.